Welcome to the Alex Pike podcast. I'm so fortunate I have Dr. Chia Chi Kao from Los Angeles here with me today, a board-certified plastic surgeon with over 15 years experience, and Vogue magazine claimed that you have single-handedly revolutionized the future of facelifts. Welcome to the podcast.
Thank you so much, Alex.
I'm fortunate enough to have spent some time with you at your practice in LA, so it's lovely to see you here for conference. Vogue magazine has claimed that you have single-handedly revolutionized the facelift. How have you trademarked your ponytail lift and ponytail facelift?
Well, I mean, a lot of times when people hear that name, they think it's just a cute name, right? It's a ponytail lift. But it actually is it's an actual technique that I developed over the last 20 years. And it involves a little tiny incision in the scalp here and here. We're able to dissect and release the tissue in the brows, around the eyes, cheeks, down here. And then we're able to lift the brows and the eyelids and the cheeks and the jowls up very effectively. Mm-hmm. And that's the ponytail lift. And the ponytail facelift is when you have to have neck skin removed, or lower face and neck skin laxity, a little bit older patients, that needs to be removed. Then is a ponytail facelift. And we try to do it all within the back of the ear, so there's nothing in the front of the ear.
So I suppose that is why patients have been deterred from facelifts in the past, having seen that wind-blown look from the 1980s, and scarring has been a big concern. So this offers a different alternative for that sort of...
Yeah, it's not only the scarring effect, but, you know, a traditional facelift is what we call bilaminar approach or biplanar approach. So what you do is you lift the skin off of the fat and you try to leave the fat down on the muscle fascia, which is called the SMAS, and then be able to lift up the SMAS and move the fat, okay? So when you do this bilaminar approach, there's a lot of effects that happens later on. Not right away, but later on. Maybe 8 months, 12 months, year and a half. Certainly by 2 years, you'll see the effects. And the effects is that you end up devascularizing the skin, because when you lift the skin off the fat, you have to cut the capillaries from the fat to the skin. So you're devascularizing the skin. And then when you're trying to move the fat by lifting off the muscle, you end up devascularizing the fat. So over time, the fat will atrophy and the skin will thin out. So you see telangiectasia, which is a little tiny capillary that forms in the face, and then you get a little bit of a melting of the fat, goes away, atrophy, and then you get the sweep. So that's what happens with the dissection itself with the traditional facelift. Mm-hmm. And then also the vector of pull is actually backwards, so then you end up shifting the skin, you end up distorting this tragus here, so the tragus is unnatural. You end up cutting the sideburns and the scars. Right now, what people are keen to do right now is to use a scar from here in the temporal hairline, around the sideburns, down behind the ear, and go back this way, go down this way. So, and then you're filleting the skin, the face open.
That also makes the ear possibly look a little unusual as well.
Tragus it usually is the most telltale part of the facelift, because you blunt the tragus and then you can have scars around there and so forth. So it's all those things put together. When I was learning the traditional facelift, I didn't like it. Mm-hmm. So I was looking for alternatives.
So I've had an aesthetic non-surgical practice, as you know, for 18 years, and my patients are aging with me, and they're very much less inclined to go with filler. I, as an injector, am less inclined to be injecting the filler. Patients are looking a little strange and overfilled. Talk to me about that.
So I think it is, as we move on from initially, fillers were great. Fillers were meant to fill, right? Fillers were meant to fill the fine lines and wrinkles, right? Back in the days of early fillers was collagen, right? So, yes, so it's collagen. So you put a little needle and you're injecting the crevices of the skin, the little fine lines, because over time the skin collapses, the dermis collapses, and you can fill that in. That is fine. But then we started using fillers, and this concept of liquid facelift came about, and it's really kind of been indoctrinated into doctors, especially more dermatology doctors and non-invasive doctors and practitioners, to be able to lift by filling, and that is where things start to go wrong. So what happens is that you're trying to lift the cheeks by injecting here. Does it really lift the cheek to inject here? It doesn't. You're trying to lift the jowls by injecting the jawline here. Does it really lift there? It doesn't. So what you end up creating is more masculine face, more broader, wider, bigger, and more square face. Especially for a female, it becomes less attractive. So what happens to these young women is that they start out with the lips. That's kind of the gateway to the aesthetics world, right? So they started injecting the lips, and then that goes on a little while, and then someone says you should contour the cheeks. That word contour is very, very sexy. And so it sounds good. So contour the cheeks, and then try to lift the cheek a little bit, and then pretty much jawline, to a little jaw, and so forth, and then just goes on from there. Under eyes.
And I find that social media is just so misleading. I have many younger women come into my practice and show me photographs of Ariana Grande with that perfect jawline. But I find that, too much filler in that area, they just end up looking rounder.
It's one of the things that I think there is a epidemic of these people, especially where I live in Los Angeles. And people are coming, and now they're starting in their 20s with their lips, and by the time they're 30, they've been overfilled, and they're stuck because they don't know what to do, because they're too young for a facelift. What they really want is it's a lift. Absolutely. But they're too young for a facelift, so they're not gonna have an incision here, and they don't know what to do. So they think more filler is gonna help, and they don't help. And I have a whole lecture on like overfill faces and filler burnout I just gave today. Yes. So at the end of the day, they want a lift. So the solution for that is to give them a lift, but without all the scars. So we can give them the lift that they want with one little incision here, one little incision here, and that's it. All in the hair, this big, and that's what we can accomplish with a ponytail lift.
So in terms of that surgery at a younger age, if a patient was in their mid-30s and they had that slight adjustment with the ponytail lift, at what point or how long would that last where they would need a secondary facelift?
Well, how long does it last? I mean, I think that what we make the changes is a permanent change. Sure. So you can either age. So you look, 5 years, 10 years younger for the rest of your life. It's a permanent change, but you still age from there. Yes. When people ask me, what age you should start, do some of this, is it too young for a ponytail lift? It's not that I don't age. I don't treat age. I treat problems at any age. Okay. You can have congenitally jowls, when you're young. As a young person, like 17, 18, you can have jowls. That's just the way your fat was distributed, and this is what you inherited from your parents. So it's just problem solving. Okay, as long as I can do it without scars that are noticeable, it's kind of like a rhinoplasty, right? So why do you do rhinoplasty? It's for beautification. Absolutely. Right? So you can do that. It's totally acceptable for young girls or boys to get rhinoplasty at age 18, 17. Okay, for what? For beautification. So why can't I do the same for the brows and the eyes and the cheeks, the jowl area, as long as I don't have the incisions to show? There's a tiny incision in the hair this big, so you don't see anything. So that's okay.
So in talking about eyes, because upper lid and lower lid blepharoplasty is a popular surgical procedure, but has also been executed for a very, very long time. How do the KAO eyes differ?
When I look at the eyes, the brows, upper lid, lower lid, cheek is one aesthetic unit. So when I start moving them, they should all sweep up together. Okay, so So when you think about a blepharoplasty, especially upper blepharoplasty, okay, when you take out skin, okay, when you take out skin, you have to remove skin, and what's underneath the skin is muscle. So you can't close the skin edges because the muscle is in the way. So you have to take out the muscle. And then what's underneath there is fat. So you have to take out the fat, otherwise you can't close it. So when you take out skin, muscle, and fat, then the edges can come together. But the only way it comes together is the brow comes down a little bit. Sure. So if you study the images on internet of before and after a blepharoplasty, you can see nice results because you have a wider tarsal platform show. The lid shows a little bit better, it's clean, that's nice. But if you look at the brow position, oftentimes there's just a little bit lower, okay? So on a female, when you lower the brow a little bit, it's more masculine, it's less attractive.
Absolutely, and that happens even with anti-wrinkle injections.
So what we do, when we do this, or when we do the eye thing, or KO eyes, we bring the cheek up along with the brow, the corner eyes come up a little bit, and the brows come up to complement that. Everything kind of sweeps together, so it's harmonious. Now, there are different degrees of KO eyes, okay? So it could be moderate, it could be mild, moderate, and dramatic, okay? So depending how much you like that, and that's really discussed preoperatively, and then we can accomplish that by the extent of the section that we need to do, how close to the corner eyes that we go.
A couple of years ago, I found you on social media because around 2019, 2020, our patients were coming in wanting the fox eye thread lift, and I had to find out all about it. And I came across your page on Instagram, and you had a highlight reel which was named Thread Eggs. So, I mean, it was just so far-fetched to me that this little tiny thread could, in effect, cause the same results as a brow lift. So talk to me about why patients are so misled by this kind of social media craze.
Well, because patients are, when they're not educated, you could be gullible, right? And just because you don't know, you're not the professional, right? And you tend to trust doctors, right? And so these threads don't work. If you go on my Instagram, Thread Eggs is there. It's just what people sent to me.
Yes.
I'm not asking for any kind of opinion. They send to me like, okay, this is what happened to me. I had this done. This is what happened to me. And usually what's consistent about what they're telling me, that it doesn't work, number one, because it only lasts from 2 weeks to 2 months tops, okay? Number one. Number two, that it hurts a lot and is very, very painful. Sometimes the pain is excruciating, they said, okay? And it's just financially, it's just not worth it, okay? And for all those reasons, it is very clear in every conference I go to, we talk about threads. No, not one surgeon or one dermatologist, they come up, they say, yeah, it works really well.
The other thing that's alarming is that it can cause puckering.
Yes, you can find it everywhere, that the puckering stays on for a long time, and it's very distressful for a lot of women with that procedure. And when I first started, when I was young, I did. When I was young, I didn't like my Asian eyes, but now everybody wants the Asian eyes, and so since I can create them, so it's called KO eyes. So, anyways.
So you're in the mecca of the plastic surgery world, which is LA. Who is the most requested celebrity look?
Well, I get a lot of Kendall Jenner's brows. I get Bella Hadid's eyes, of course. And I get, I don't know, maybe Scarlett Johansson's lips.
Yes.
Yeah.
Yes. So Dr. Kao, a quick Q&A. Who would you think, in your opinion, is aesthetically the most beautiful woman in the world, past or present?
Audrey Hepburn is amazing. I mean, look at that face. No Botox, no fillers back then. And just natural aging. Her brows, eyes are so gorgeous, so beautiful. She's gorgeous.
I'd say Raquel Welch.
Yeah.
I love her bone structure. Yeah. Who would you say, in your opinion, is the most aesthetically pleasing man, past or present?
To be honest with you, I don't look at men very much. I don't. So that's I guess most people would say probably Brad Pitt or, that kind of, I think people like his jawline and so forth. And then George Clooney's chin, something like that, but.
I asked the girls in the office these questions today and they all said Brad Pitt.
Oh, really?
Yeah.
This is blonde. It looks like Australian, maybe.
I don't know. I'm a big Paul Newman fan. Yeah, I think he's so beautiful facially. Yeah, when he was younger, absolutely gorgeous. Dr. Kao, what is the most requested skin treatment?
The most, in terms of lasers skin treatment I think we really believe in is microneedling. Mm-hmm. That works very well. You can add on all sorts of topical regenerative stuff, PRP or exosomes or things like that. So it works very well. And then for fine lines, wrinkles, or pigmentation, we are very good with Amoxi BBL. I think that works very well.
In terms of trends in 2023, what are you really seeing for plastic surgery?
In 2023, I think there's going to be more. I think it's going to get smaller. Breast implants go smaller. The BBL is going to get smaller. I really think that it's really kind of overdone, and this sort of like the queen bee shape with a big huge hump in the bottom is probably going to be a passé thing in next year or two. So that and hopefully people are. Even dermatologists are starting to realize, hey, we really should be careful about over-injecting the face and overfilling the face, because people are starting getting the reports, scientific reports that there's actually, when you put a lot of fillers under the lower eyelid, in the lower eyelid area, there's lymphatic blockage, and they get chronic swelling that comes and goes. It doesn't go away. So it clogs up the lymphatic drainage. And fillers, people are start realizing it's not true that fillers goes away. It doesn't go away in 3 months. No, it stays, and it builds up, okay? And then builds up, makes your skin look stiff, okay? So in terms of, when I interview patients, I give them concept of lifetime syringes. So say 10 years, okay? Then I ask you, so how many times a year do you go in to get fillers done? People usually say, 2 times or 3 times, okay? And then I said, okay, well, each time you go in, how many syringes do you get? They'll say, maybe 2, 3, 1, or whatever they say, right? So you kind of do the math on that. So sometimes people could be 35 years old. They have had 120 lifetime syringes, and they're way overfilled. Okay, so when you're about 60, that's when I see the real problem starts. Sure. So we have 60 lifetime syringes. For most people, that's where the problem starts. So that's kind of a concept that I've been talking about.
For me, it's the distorted look and the puffiness that, patient just starts to look almost a bit dragged down from the overuse of fillers. Yep. So it's not something, moving forward in my practice that we're really encouraging. We're very fortunate to have had a bioremodeling product be launched in Australia last year. I'm not sure that you have it in America yet. That's been a really nice addition for the skin quality. But I think that in 2023, there also will be a bit of a push towards more surgery.
I think so, but more surgery done, and hopefully done with less incision, right? Especially these young patients. And it breaks my heart. It hurts me. It hurts me to see a beautiful girl in the 30s or even 40s beautiful, and they have scars right here for facelift, for mini facelift, or weekend facelift, or a two nip in the butt, it's not worth that incision, right? So it just breaks my heart because I know they didn't need that incision. So with tool and incision, we can accomplish all that what they want.
In terms of necks is a common area that patients complain about. Do you operate on only necks as a neck lift, or is it a combination?
Well, it's sort of like, it depends on what the problem is, right? So I tend to look at the patient, the whole face and neck together. If they have isolated neck problem, then yes, we're just going to do the neck. Okay, so for the neck, what I usually do is that people, most commonly patients that are younger, they have a neck problem, is the double chin. You can be 15 years old, 25 years old, you can have a double chin, and that's just congenital. Okay, and the way that people deal with it usually is liposuction or Kybella, right? But I caution that because when you look at the neck, there's skin, there's subcutaneous fat, and then there's a muscle they call it platysmal muscle. And then under the muscle there is more fat, subplatysmal fat. Then there's muscle here called the anterior belly of the digastric muscle. And then to the sides, there'll be submandibular glands. Yes. Okay, so when you have a bulky neck, okay, that bulk could be in the subcutaneous fat or deep under the platysma with all the muscle problem, the gland problem, or subplatysmal fat problem. Okay, so when you do liposuction, you're trying to reduce that bulk just in the subcutaneous plane. You can't go deeper than that, right? So you end up thinning the skin a lot.
But you still have the problem.
You can still have the problem, or the problem is you can solve the problem temporarily, but over time what happens is the skin of the neck will be loose. So you actually will have some premature sagging of the skin. The neck skin is really, really it's really delicate, especially for female, because when you move, when you turn, the skin follows. And if you don't have good support for the skin, when you take the fat away, then the skin will kind of droop and sag a bit. And sometimes when the liposuction gets really aggressive and you thin it out a lot, there can be actually a scar tissue that forms from the skin to the muscles. When you swallow, it kind of tethers. When you look around, it can tether. That can show up. And then they can form these bands as well. Yes. So the moral of the story is that the subcutaneous fat in the neck, especially for women, is super important to keep it supple. Mm-hmm. So when I do the neck, I don't like to liposuck at all. Okay, I make a little tiny incision here. I lift all the fat off of the muscle. Then I go under the muscle. Then I take the bulk out of the deep compartment, shaming on the muscle, tighten the muscle, the anterior belly of the digastric muscle, and then removing the subplatysmal fat, and then tighten that up. You know how people, sometimes when they swallow, they can have a little froggy. Yes. They can, when it comes down, come back up. So that's a laxity in the floor of the mouth, and that is laxity of the anterior belly of the digastric muscle. So we shave that down, we tighten that, and it just comes up really, really nicely. Okay, so then we look at, after that is done, then we look at the subcutaneous fat. If it's thick, we'll kind of plane it very gently so that everything's even, so that we can have a nice contour. But we don't want to liposuck it because it's inaccurate. Okay, so that's how I do the neck.
I met a beautiful woman in your waiting room one day when I was waiting to see you in Santa Monica, and she was telling me about her journey in having the ponytail facelift. It was something that she had wanted for many, many years, and she'd made the decision and she'd traveled a very long way to see you. How much time should a patient allow for the recovery process from having your surgery?
About 90% of our patients are international or out of town. And we prefer for them to stay with us in Los Angeles for 3 weeks. Yes. Okay. So they have surgery, but we have our own recovery suites. So they get wheeled from this operating room down the hall to the recovery suites. And they stay there for 5 days or so. During that 5 days, there's 24-hour nursing care, and the hyperbaric oxygen is right on site. So they go to that hyperbaric once or twice a day, and then they can have IV therapy, they have lymphatic massage, and then they have a skincare regimen going. So it's a whole comprehensive treatment plan, even after the surgery.
And healing process.
Yes. So we have all those things available. And then I asked them to stay around for 3 weeks just to make sure everything's good, and then they're happy.
And are they suitable to go back to work after that time?
Well, it depends on how much we do, what we do. It depends on the age of the patient, the type of skin they have. But in general, for ponytail lift on young patients, people are usually pretty good, what I call restaurant ready, in about 3 weeks or so. That means they go to the restaurant, people at the restaurant, they don't know you. They think you're beautiful. They don't see anything. They think you look great. And then your friend's going to say, who you go to a restaurant with, they're going to say, Alex, you look beautiful. I can see that you still have swelling, but it's probably you're going to look great in another 4 to 5 weeks. If you're a celebrity person, we're trying to go under the radar. So I said no camera work for 10 weeks.
10 weeks.
Yeah, to be sure.
Where are patients traveling from to see you?
We actually have funny you ask, because last Christmas, my staff gave me a big, huge board of a map. Oh, okay. And we started putting all of our patients in little pins, like where they come from. And we were still working on that little project because we only got 2 years, and we have many more years to go. But there come a lot of them from Middle East, in Dubai, Abu Dhabi area, a lot of Lebanese in the Middle East. We have quite a few Russian. We have a lot of Europeans from London. I've won a few. I remember from Morocco, but they're all over. In the States, mostly probably Florida, New York, and Texas, San Francisco.
And what's next for you?
What's next for me? Well, if you follow me on my social media, my Instagram, you'll see that I just launched my regenerative medicine branch of the triad that I have. So I have aesthetics, which is laser, Botox, filler, non-invasive stuff, plastic surgery, and now regenerative medicine. So what we do there is we are, because I feel like I'm good at working from the outside in with surgery and non-invasive stuff, but the cells are still getting older. And the cells, when they get old, they don't communicate very well. So that's when they have miscommunication, the cells don't work well, and then you have problems with your health and wellness, and things start to decay, right? So we actually launch with a laboratory that's based in Ireland, UK. This is a 6-year project I've been working on, and finally come to fruition. So they are very advanced in DNA testing, biomarker testing. So with a little drop of blood, you can test for all sorts of cellular markers and telomere length and all these other, your biological age and all these things. So we can really kind of assess how your cells are talking to each other, and then we can and test for all that, and then we can come up with a regimen of customized supplement to encourage and to fortify the communication between the cells. So for cellular health, and that's one thing, and then we're getting back into. Then we're going to start our regenerative medicine in terms of stem cell therapy and more pushing the envelopes a little bit for anti-aging.
So we are seeing an increase in male patients. What about for surgery?
Yes, I think males are more conscientious of their looks because their ladies are looking better, and they get nervous, you know. they don't want to be left behind. And because I have couples, you know, I do the wife or the girlfriend, and then the man says, well, what about me? I said, well, we can. So usually typical thing for men is eyelid surgery. So blepharoplasty, or over the brow. You can be careful with the brow with a male, because you want to lift it too high that you can feminize the face. And then necks, a lot of stuff in the neck. So get those two things down. The male surgery is a little more mechanical. So they just are interested in getting rid of the excess skin in their neck. You know, you can't make a man look too pretty.
Also, their skin is actually quite thick.
Yeah. And actually they can be quite stretchy. They grow a lot of skin.
There was that look of the 70s and 80s of a male facelift that was quite obvious.
It's hard because the skin is thick and is bearded on the side, so this don't scar very, very well. So male, so the ponytail technique is actually more important in males, because you gotta get that incision right, or that area correct, you know, because it could just be, there's nothing less attractive to a female, I think. I've been told that for a male to have all these scars and they're trying too hard.
I agree. I think men have been allowed to age a lot more freely than women from that perspective. Thank you so much for joining me today on the Alex Pike podcast, Dr. Kao.
Thank you so much for having me. Thank you.